And another common sign, which is sometimes a hard one to track pre or postpartum, that's a dramatic shift in mood or behavior. And if you experience this and you're in your perinatal time of your life, then it certainly doesn't immediately mean that you have a mental health condition. You know, hormones raging through our body, it's almost a natural thing to occur. But with dissociation, it will be more severe. And their mood shifts will, you know, feel like they're emotionally distant or extremely intense emotion that seem to come out of nowhere. They'll come really quickly, and they don't really fit the situation that they're in. So they may also display changes in behavior or engage in activities. You know, talking about timing, they'll have no recollection of engaging in things. And they're not having a recollection of those intense emotions. That can then become a first clue that maybe you are experiencing dissociation or depersonalization. And in more severe cases, people may experience having, but that's really severe cases, multiple identities or personalities. Excuse me. This is also called DID, dissociative identity disorder. And I think it used to be called multiple personality disorder. And this more severe form of dissociation is really a very severe one. That's when a person has distinct and separate identities, and they're often referred to as their alter egos or alters or their parts. And most likely they will have names, or they will have characteristics, memories, they'll have certain behaviors. So basically it's a whole separate person within a person, a separate identity or identities. And again, these are the very, very severe cases, and they will be most likely they will be very they will be easier to spot. So again, that's some of the signs and symptoms that can be important to note here, that this experience is different for each and every individual, but these are signs and symptoms that can be associated with dissociation. So what I've described so far, that's more general information. But what's important to know, what can trigger dissociation, you know, especially talking about postpartum mental health. Triggers for dissociation are very often traumatic events and high levels of stress, or a long time of high stress levels. And also significant life transitions. So big changes in your life. And now you may be able to see the link with pregnancy. You know, where pregnancy or a birth, the aftermath of birth and pregnancy, they can have huge, huge impact on someone's life, you know, be it the mum, the dad, or another family member. Pregnancy is a period of immense physical, hormonal, emotional changes. And unfortunately, sometimes traumatic as well, but even if it wasn't traumatic, it can still be an extremely stressful time for many reasons. And I think we can all agree that post-pregnancy life, that requires a huge alteration in lifestyle. And for some, that transition from their old life into a whole new life, which happens fairly quickly, when you become responsible for another human being beside yourself, that can be such a big change that it really starts to mess with somebody's mental well-being. And I haven't even mentioned the societal expectations, you know, the financial stress, maybe lack of support. And all these things can be contributing factors to developing dissociation disorder in new mums or in new parents in general. And I looked up some numbers, and it's estimated that around 20% of women experience some form of dissociation during pregnancy or in the postpartum period. That's a shockingly high number. That's 1 in 5 mothers that experience dissociation. And they don't all continue into a disorder, But not being aware of the signs and symptoms, not being on the lookout for them and not acting on them, that can really, it can really become a disorder. So why are these numbers so high? Because we all know that, our hormones, they play a huge part in conception, and, fluctuations in hormones, in turn, they can impact then mood regulations, and they can contribute to dissociative symptoms. So again, it doesn't have to go into disorder straight away, but they can really contribute to dissociation symptoms of dissociation. Sorry. So never underestimate the role of previous trauma in this story, because unfortunately, a pregnancy or a birth or postpartum period, they can trigger past traumas. Individuals who have a history of trauma, think of childhood abuse, neglect, really any form of trauma. It doesn't even have to, even a car accident or a disease, loss of a partner. They all, having gone through a previous trauma, may be more vulnerable, may be more susceptible to dissociation during pregnancy or postpartum. And another big trigger is the lack of social support. So when you start feeling isolated, or because you have an insufficient support system, those are also situations that can, what's the word I'm looking for? They can exacerbate feelings of dissociation in new mothers. And it comes as no surprise that dissociation can be a huge disruptor, a very rude disruptor, disruptor, even a word, disturber. I don't know if that's a word either, but that can significantly impact the well-being and the dynamics, of the whole family, especially if there's other children involved, or grannies, grandpas, anyone. It can have such a detrimental effect on a whole family. And mothers may not feel that they're able to emotionally attach to their baby. And all these negative emotions that latch to that, think of guilt or shame or overwhelm or stress, or, generally struggling to cope with the challenges of motherhood. And then these are all contributors to an increased chance of developing postpartum depression, postpartum anxiety, and lots of other disorders. And that goes for dads as well. I made a video on that just recently. So for dads or partners, that's awful to witness, their partner's dissociation. And they may feel helpless, confused, inadequate, in providing support. And that can, again, dislodge the family dynamics. And all that negativity, that may potentially have an impact on other children in the family. The parent-child bond may go through really rough patches, leading to potential developmental and emotional consequences for the child. So it's hard for a child to see their mum or dad distressed in any case, and they will find it really hard to understand, why their mother's change in behavior toward them, why and how it came about. And again, the extended family members or the friends, your social circle, that may also be impacted by this dissociation. If they aren't aware of what it is, because often it comes down, the first steps in getting over things is coming down to understanding things. If they find it hard to even understand it, they'll find it hard or challenging to provide adequate support. And that is exactly what someone in this position is in need of. That's what they need. They need support. It becomes sort of a metaphorical snowball effect where people will start to distance themselves from you because they can't understand you. And that means that your support system may collapse. And that means that the dissociation you're experiencing may snowball into a dissociation disorder. So you see why it's really crucial to be aware of at least the signs and symptoms of dissociation to identify and then address the issue. And yeah, so some common indications, you know, early intervention and appropriate support, that's essential in addressing dissociation during and after pregnancy. So if you suspect that your loved one is going through dissociation, then please seek assistance from a mental health professional who is experienced in perinatal mental health, preferably, but any mental health professional as a first step will do. There are interventions that can really help to get this mum back on track. Think of therapy approaches such as CBT therapy, cognitive behavioral therapy. There's also EMDR that's proven to be very effective, eye movement desensitization and reprocessing. Hope I said that correctly, EMDR. But also some mindfulness-based interventions can be effective in treating dissociation. I use subconscious mind to trigger change in thought patterns in my practice, where you can come away from traumatic events and learn to look at events differently, learn to think about them differently, which makes it easier to have a choice in how you go about a situation. And dissociation takes away the choice that you have, and I can help you retrieve that choice with my therapy. And it's a very quick therapy, a very long-lasting one, and usually takes 1 or 2 sessions, and there's no medication required.